Welcome back to the deep dive. Today we're tackling something that might sound a bit, well, in the weeds, but it's actually fundamental to how healthcare works financially. We're talking about medical billing accounts receivable, or AR follow-up.
That's right.
Now, did you know that without this process, hospitals, clinics, they could lose a massive amount of money they need to, actually provide care.
Absolutely. It's
So
great.
this isn't just bean counting. It's really about the financial health that lets your doctor's office stay open. So our mission today, unpack what AR follow-up is, why it matters so much, and how it actually works based on the sources we've looked at. Okay, let's jump in.
Okay. So what's really fascinating here is that medical billing AR follow-up is basically the essential process making sure doctors of hospitals actually get paid for the care they give.
Right.
Every single unpaid claim. It's not just a number on a page. It's like a leak in the financial pipeline.
Mm.
So the process involves um, actively tracking down those unpaid claims, figuring out exactly why something wasn't paid or maybe paid less than it should have been,
Okay.
and then really going after that payment, whether it's from an insurance company or sometimes the patient themselves.
So it's like detective work for medical bills.
Exactly.
Yeah.
Yeah, financial detectives, that's a good way to put it. The main purpose, the core goal, is to comb through all the outstanding claims.
Mm-hmm.
Then you contact the payers, could be Aetna, could be Blue Cross, could be the patient. You sort out any denials, any underpayments, anything that's just stuck.
Uh-huh.
And ultimately, it's about getting the maximum possible revenue collected and doing it within these really strict, timely filing limits set by the payer.
Deadline's right.
Deadlines are huge. It ensures the whole system can actually function financially. It keeps the lights on.
That makes sense.
Mhm.
So you mentioned chasing payments from insurance and from patients. I imagine those are pretty different conversations, right?
Oh, absolutely.
Oh.
They're distinct processes. We usually talk about two main types. You've got insurance AR follow-up. That's all about the money owed by insurance companies.
Right, the big players.
Exactly. So the actions there are things like checking a claim status online or on the phone. Is it pending? Denied? Paid wrong? And then if it's denied, you might have to appeal it. Or maybe there was a mistake, like a coding error, so you correct it and resubmit the whole claim. It often involves talking directly to insurance reps.
And a simple mistake, like a wrong code, could hold things up for ages.
For weeks, even months, yeah. It turns what should be straightforward payment into this resource drain.
Wow. Okay, so that's the insurance side. What about the patient side?
Right, so the other bucket is patient AR follow-up.
Mm-hmm.
This is about balances patients owe directly. Think copays, that flat fee you pay at the visit,
Sure.
or deductibles, what you have to pay out of pocket before your insurance starts paying, and co-insurance, which is your percentage share, after the deductible is met. Each of those needs a slightly different approach, because why someone hasn't paid their copay might be different from why a large deductible bill is outstanding.
Makes sense.
So for patient AR, the actions are more like sending out clear, detailed statements, maybe making follow-up calls or sending emails gently, of course, and often setting up payment plans to help people manage those costs over time.
Okay, so we get the what and the why. But let's talk about the how. For the person doing this job day in, day out, what does their workflow actually look like? Where do you even start?
Well, typically the starting point is something called the AR Aging Report Review.
Aging report.
Yeah, think of it like a dashboard showing how old all the unpaid bills are. It breaks everything down by time buckets like 0 to 30 days overdue, 31 to 60, 61 to 90, and then 90 plus.
Ah, okay. So you can see what's been sitting there the longest.
Exactly. It lets the specialists zero in on the oldest claims, or maybe the ones with the biggest dollar amounts, because those usually need attention first. Priority setting. So from that report, they'll start investigating. They check the claim status, maybe using online portals the insurance companies provide, or sometimes they just have to pick up the phone.
And what kind of problems do they usually find?
Oh, common things are like missing paperwork the insurer needs, or coding errors getting those CPT codes for procedures, or the ICD-10 codes for diagnoses, or HCPCS codes for supplies just slightly wrong.
Those codes sound like a whole language in themselves.
They really are. And a
Hmm.
tiny slip-up can get a perfectly valid claim kickback. Or maybe the issue was patient eligibility. Perhaps their coverage had lapsed.
Okay, so they find the problem. Then what?
Then they take action. If it's a denial, they might appeal it. If it's a coding error, they correct the claim and resubmit it. If the insurer just needs more info, they provide that documentation. And this is critical. Every single step, every phone call, every submission gets meticulously documented,
Mm.
usually in specialized software like EHR systems or specific billing platforms. That record keeping is essential.
It sounds incredibly detailed. Beyond just being organized, though, what else makes someone really good at this? Is it like negotiation skills or something else?
It's definitely a mix. Yes, strong organization is table stakes, but they also need deep knowledge of all those different insurance rules,
Yeah.
which can be super complex and, like we said, the coding systems.
Uh-huh.
But yeah, communication and sometimes negotiation skills are huge. They're essentially advocating for payment. That means having tricky conversations sometimes with both the insurance companies and occasionally with patients. It takes a lot of patience, persistence, and good problem-solving skills.
This really paints a picture of a hidden but absolutely vital part of the healthcare machine. So bringing it back out, what's the bigger impact of all this meticulous follow-up work on, us, on our healthcare experience?
Yeah, that's the key takeaway, really. If you connect this to the bigger picture,
Hmm.
think about how well this AR process runs or doesn't run. Its efficiency, or lack thereof, quietly has a direct, or at least indirect, effect on the costs you end up paying for healthcare.
Mm.
It impacts what services are actually available in your area, and fundamentally, the financial stability of the hospitals and clinics you depend on. It really is the quiet engine keeping the whole medical system running, financially speaking.